Pregnancy can be a time of joy and anticipation, but it can also be a time of uncertainty and loss. Two terms often misunderstood are miscarriage and abortion. It's important to define them clearly. Miscarriage is the spontaneous loss of a pregnancy before 20 weeks. It's a natural occurrence, often due to factors beyond a woman's control. Abortion, on the other hand, is the termination of a pregnancy. This can be induced or spontaneous. Induced abortion refers to a medical procedure or medication taken to end a pregnancy. The distinction lies in the cause. Miscarriage is a natural loss. Abortion involves a deliberate action to end the pregnancy. Both experiences can be physically and emotionally challenging. Understanding the difference is crucial for providing appropriate care and support to women. It's also vital for informed discussions about reproductive health. Miscarriage is more common than many realize. It affects about 15% of pregnancies. Despite its prevalence, it remains a taboo subject. This silence can leave women feeling isolated in their grief. The physical symptoms of miscarriage vary. They can include bleeding, cramping, and passing tissue. Emotional responses are diverse too. Women may feel sadness, guilt, anger, or a combination of emotions. The loss of a pregnancy at any stage can be profound. It's important to acknowledge these feelings as valid and natural. Support from partners, family, and friends is crucial during this time. Seeking medical care is essential to ensure physical recovery. Equally important is access to counseling or support groups. These resources can help women navigate the emotional aftermath of miscarriage. Induced abortion is a complex issue, often surrounded by strong opinions. It's crucial to approach this topic with sensitivity and respect for individual choices. Induced abortion refers to actively ending a pregnancy through medical or surgical means. Women choose abortion for a variety of reasons. These are deeply personal and can include health concerns, financial instability, relationship issues, or simply not feeling ready for parenthood. It's important to remember that the decision to have an abortion is deeply personal. It's not a decision taken lightly. Women deserve access to safe and legal abortion services. Denying access to safe abortion doesn't stop abortions. It only makes them less safe. This puts women's health and lives at risk. Medical abortion is a non-surgical method of ending a pregnancy. It involves taking medications that stop the pregnancy from developing. This method is typically an option in the early stages of pregnancy up to 10 weeks. The medications used in medical abortion are highly effective. They work by blocking the hormone progesterone, which is essential for a pregnancy to continue. This causes the uterine lining to break down. Another medication then helps to empty the uterus. This process is similar to a miscarriage and involves cramping and bleeding. Medical abortion is a safe and effective option for many women. It offers privacy and can be done in the comfort of one's home. However, it's crucial to have access to accurate information and medical guidance throughout the process. Section 5. Surgical abortion, another path. Surgical abortion is another method of ending a pregnancy. It involves a minor surgical procedure performed by a trained healthcare provider. This method is typically an option in both early and later stages of pregnancy. There are different surgical abortion procedures. The most common is vacuum aspiration. It involves using gentle suction to empty the uterus. Surgical abortion is a safe and effective option. It's usually a quick procedure, often completed in less than 30 minutes. Recovery time is typically short. As with any medical procedure, there are potential risks and side effects. These are generally rare and manageable with proper medical care. It's crucial to discuss any concerns with a healthcare provider. Section 6. Miscarriage in Pakistan, a silent struggle. In Pakistan, miscarriage carries a heavy burden of silence and stigma. The estimated rate of miscarriage is 15%, impacting countless women and families. Several factors contribute to this high rate. nutritional deficiencies, limited access to quality healthcare, and genetic disorders play a role. Additionally, domestic violence and hazardous work environments can increase the risk. The emotional toll of miscarriage is compounded by societal pressures. In a culture that often places high value on sons, women who experience miscarriage, especially repeatedly, may face blame and isolation. This silence surrounding miscarriage prevents open discussions about its causes and impacts. It also hinders women from seeking the medical and emotional support they need. Section 7. The weight of stigma, societal impacts. The stigma surrounding both miscarriage and abortion has profound societal impacts. It creates an environment of fear and silence, preventing women from seeking help and support. This stigma often stems from a lack of understanding about reproductive health. Misconceptions and misinformation contribute to the shame and judgment women face. The silence around these issues also limits research and data collection. This makes it difficult to fully grasp the scale of the problem and develop effective solutions. Breaking the stigma is crucial. Open and honest conversations about miscarriage and abortion are essential for creating a more supportive and informed society. Section 8. Legal landscape of abortion, a global perspective. The legal landscape surrounding abortion varies dramatically around the world. Some countries have liberal laws allowing women to access safe abortion services. Others have restrictive laws making it difficult or even illegal to terminate a pregnancy. In the United States, the legal status of abortion has been a subject of intense debate for decades. The landmark Roe v. Wade ruling in 1973 legalized abortion nationwide. However, this right has been increasingly challenged and restricted in recent years. In Pakistan, abortion is legally restricted. It's only permitted to save the life of the woman or in cases of fetal impairment. This legal framework often forces women to seek unsafe abortions, putting their health and lives at risk. The legal landscape surrounding abortion has a direct impact on women's lives and health. Access to safe and legal abortion services is essential for ensuring women have control over their bodies and reproductive choices. Section 9. The need for empathy and access. The experiences of miscarriage and abortion are deeply personal. It's crucial to approach these issues with empathy, understanding, and respect for individual choices. Women deserve access to accurate information about their reproductive health. They also deserve access to safe and legal healthcare services, regardless of their decisions. Breaking the silence and stigma surrounding miscarriage and abortion is paramount. Open conversations, education, and advocacy are vital for creating a more supportive and informed society. Ultimately, ensuring women have the knowledge, resources, and support they need to make informed decisions about their reproductive health is essential for their well-being and for a more just and equitable world.